Thanks to a whole slew of factors, from modern medicine to better nutrition, people are living longer. And one area of practice wants to help you stay on top of your health by offering you a portal into all your medical information. I found out more.
Medical Associates is a multi-specialty group with primary care physicians, infectious disease physicians, endocrinologists, and hospital physicians.
So, a lot of everything. And you guys offer something very interesting to your patients. Tell us a little bit about that.
We just started with a online health program called Follow My Health, or Patient Portal, which is a way for patients to directly communicate with their physicians.
And that's neat. So, when you say directly communicate, what are you going to communicate? Literally.
Well, patients can send messages. They can also access their health records. They can access what's been done in our office. So anything from lab results to office visits to vital signs to medication lists.
And that's a fantastic idea, too, because sometimes I'll go home and I'll go to relay something to my husband and I think, I forgot about half of what they told me. That's an important thing, too, especially when you're thinking medications and what's important to take on a daily basis.
Exactly. We do try to provide every patient with a paper copy of their plan, their medication list, their labs when they leave the office. But as we know, paper gets lost. Right. But there is a way that you can access this online.
That's really neat. Now, say you go to a specialist or something. Is there a way to check that that specialist has sent stuff? Is there a way for you to update your own information?
You can always send the primary care physician a message. Mm-hmm. Hopefully that specialist will send the physician a note. Mm-hmm. So say I've referred a patient to an orthopedist. I will hope that that orthopedist will send me a note back. But the patient can simply relay a message saying, hey, I saw this physician and they're planning to do this, or they think it's this, and I'm going to have this test or this procedure.
And one thing, too, which seems like such a good idea with this, is that when you're prescribing medications, sometimes they overlap. And if everybody's getting the same information on what the new prescription is, that seems like it's a good fail-safe.
Yes, exactly. Mm-hmm. That way you can double-check your list with the physician's list. Mm-hmm. And it will not only have current medications, but discontinued medications.
And what's been the patient response so far to this?
It's just getting rolling, but I've gotten several messages from patients with clarification questions and or wanting to give me some information.
And you and I were talking earlier about you seeing this as the wave of the future. You know, do you feel like your patients these days with the internet and everything come into a meeting with you more informed?
Definitely.
That's good.
There is a lot of information out there. So someone can Google a symptom and come up with a whole list of possibilities. So the internet can be a little bit of a dangerous place as well, because there is also a lot of information out there that the layman may not be able to interpret correctly. That can be really scary to a patient.
So if folks are interested in coming to see you, tell us a little bit about what you do.
Well, I am a primary care physician. I'm an internist, so I specialize in adult medicine. I'm the person you come to for everything. Uh-huh. And if there's something that I can't handle, surgery per se, uh-huh. I refer you to somebody else. But I'm the person who kind of coordinates all of a person's health care.
And you take care of the health care, and you have a little visitor sometimes when folks come in here as well, right?
Yes, I do. My 1-year-old standard poodle, Sasha.
Aww. And I understand Sasha's going to be a therapy dog, right?
We are working on training her to be a therapy dog, but she's really gotten a very good start. She has been coming to the office with me since she was 8 weeks old, And she has provided a lot of joy for staff and patients alike. She comes into patient rooms very often. Not all patient rooms, but she has been coming into a lot of patient rooms. And it's amazing to see the transformation when she does visit. A patient can go from feeling not so great to a lot happier, just with the love of a dog.
And if you are a Medical Associates patient and want to learn more about the portal or want to become a patient with them, you can call Medical Associates at 434-947-3944. And to link to that portal, you can go to centralvamd.com.